Hello, I'm Dr. Will Enright, and I would like to discuss 3 different approaches that are used for hip replacement surgery. Here at OSMS, we get a lot of questions from our patients about which approach is the best and which approach will result in the quickest recovery. I will provide information on the approaches, including which is the best. All 3 approaches have been in use for decades. The original descriptions carried the names of the orthopedic surgeons who popularized their use. Today we call them anterior, lateral, and posterior approaches. Patients often come to us after seeing an ad for the latest and greatest approach to hip replacement that promises less pain and quicker recovery. The fact is that these approaches have been around for a long time, and at OSMS we have experience with all 3. The posterior approach for hip replacement is the most common in the United States. Patients are positioned on their side, and the incision is on the outer hip, slightly toward the buttock. The lateral approach is performed with the patient lying on his or her back. The incision is more directly over the outside of the hip. The anterior approach is also performed with the patient lying on his or her back, but the incision is more in the front and extends toward the front of the thigh. Seeing the anatomy of the patient's hip is important for the proper placement of the hip replacement components. All 3 approaches provide the surgeon with a good view of the hip joint. The anterior approach does rely on live X-ray taken during the procedure to check on position of the components. As orthopedic surgeons, we are always perfecting our surgical technique to minimize trauma to the body. The terms muscle sparing or minimally invasive are sometimes used to describe this pursuit of better techniques. The 3 approaches used in hip replacement are based on tissue planes. The technique is to go in between muscles or divide a single muscle in line with its fibers without damaging the nerve that supplies the muscle. This is like parting curtains of muscle. In every technique, the hip capsule is cut. The hip capsule is comprised of several ligaments that serve to stabilize the hip and contain the joint fluid that lubricates the joint. The capsule must be cut to remove the femoral head and prepare the way for the hip replacement components. In most instances, the capsule is repaired at the end of the procedure. We measure success in terms of pain relief, function, and longevity. A successful hip replacement results in a pain-free hip that allows improved function for the patient. These 2 factors taken together lead to better quality of life. We also want this to be the only hip surgery the patient needs to have. Years ago, it was thought that hips would inevitably wear out and need another surgery after 15 years. Thanks to innovations in the materials that make up the components, hip replacements are lasting much longer. Even more important than materials is the position of the components. Picture a room with 3 doors leading into it. It matters less which of the 3 doors you use to enter the room, and more how you arrange the furniture once you are inside. So, which approach is best? The best approach is the one that your surgeon can most consistently put the components in the proper position. Ask your surgeon which approach he recommends for you. This will have the greatest effect on both your short and long-term satisfaction with total hip replacement.